Perfect. All right, welcome everybody to today's Zoom call. We have some questions that came in on email, so we want to address those first. And again, just a reminder, if you have questions that you want us to address on these Zoom calls, that you don't feel like you are able to butt in, you don't like to ask questions live, or you want to remain anonymous, or you can't get on the Zoom call for some reason with your schedule or something, feel free to email them, but please put in the email Zoom call question, because we get literally about 150 emails a day, so we don't want it to get lost. So here we go with some questions. So here is a question. When I went over my immunotherapy protocol, and this person was talking about medical immunotherapy, um, in the beginning with my oncologist, they directly asked me if I was doing coffee enemas, to which they replied, good, when I said no. So the question really is, why would an oncologist be happy that you're not doing coffee enemas when doing immunotherapy or chemotherapy for that matter, or radiation for that matter? Why are oncologists tend to be negative towards that and not want you to do that? Well, I the answer is I think they just are ignorant about what coffee enemas do and what natural therapies do. So now, I have always taken the high road when I've talked about oncologists and said, they know what they know and we know what we know, and we just need to get together and shake hands and be friends. But sometimes when you get these kind of things, when you get oncologists that are very anti anything other than what they do, it gets a little frustrating from my point of view as a practitioner. And I think it should make you a little frustrated too, because they're supposed to be taking care of you as a cancer patient. And just because they don't understand another procedure doesn't mean that they can't go home just like me and open up their computer and Google some things and learn a little bit. I'm not asking them to become specialists in nutrition, or to fully understand coffee enemas, but anybody could open up Google and Google coffee enemas and immunotherapy, and they'll find that there isn't any studies that are done that are negative about coffee enemas and immunotherapy. And I would, this is what we are here for you to do, is for you to ask these questions. So this is a great question to ask us, but I would challenge you too as individuals to do your own research on these things, so that you feel confident in what we're telling you to do too. So I don't want you just to trust us, but I certainly don't want you just to trust them either. You need to do your own research too. And if you don't feel comfortable doing something, well, then by all means, don't do it. But also don't listen to your oncologist just because they say not to do something. Do your own research and make sure you make your own decision based upon what you look up. The Bible says there's wisdom in a multitude of counselors, but also the Bible says that we're not supposed to take too much advice from too many people. So that's kind of contradictory, but it's really not. So get information from a lot of people, but then ultimately you got to make that decision what's best for you. So the second part of this question was, my protocol from you states that I should do 1 to 3 times a week a coffee enema. And really, you could do a coffee enema every day. And of course, it's conflicting information because the oncologist is telling you otherwise. We're telling you one thing. Um, I can't find any valid research that says that coffee enemas have any negative effect while doing chemotherapy, while doing immunotherapy. Matter of fact, you can pull up a really nice research paper. I gave you the link right here. And it's hard to copy that down while we're talking, but again, this will be recorded and you can copy that link down and search for it. And it's a really well done paper on how coffee enemas, what it does when a person's doing chemotherapy, radiation, or immunotherapy, and it can actually make it much more effective. And the writer goes through multiple topics: caffeine reactivates the immune system near the tumors, gives much research data that that is true. Caffeine reduces new vessel formation, that is angiogenesis, so it inhibits angiogenesis in the tumor, which is exactly what we want. Caffeine induces vasodilation to the tumor so we could get oxygenation and nutrients to the tumor, and we could say chemotherapy to the tumor and immunotherapy to the tumor. What immunotherapy does is, remember what immunotherapy does, it disables that receptor site on your immune cells, your T cells, so that your T cells can then effectively kill cancer. But if you don't have good blood flow to that tumor, the T cells are just going to be killing your own cells, causing all sorts of side effects with immunotherapy, which patients have. And so if you could get the T cells more directly to the cancer, you're going to have much better effect. Caffeine doesn't allow tumors to go into the repair mode, which is very well researched in this paper too. So look at that paper, you'll see that data. Um, it's unfortunate that your oncologist doesn't just look up some of this stuff. They tend to take a scorched earth approach. There's a lot of oncologists that really want what's best for you, and they want to, they want you to do what's best, but there's some things that they're ignorant about, and they will just tell you, I don't know, make your best decision about that. But when they overtly tell you to do something that they have no research data about, that's what kind of fries me a little bit. And it's not in the best interest of the patient, and you've already violated your oath as a doctor. So another question on that same issue is, should I ask my oncologist when they, when they asked about specifically about coffee enemas, or should I tell my oncologist what I'm doing? That's a common question that we get. Should I tell my oncologist about the nutrition that I'm taking? I really want to be upfront with my oncologist. That again has got to be a decision that you make. So, I don't, when I go in and do something for my myself, when I choose to get therapy from one doctor, do you have to disclose everything that you're doing? That's a decision that you personally are going to have to make. You have to make the decision whether they are equipped enough to really answer that question. Um, and that can be a feeler for you. If you say, should I do coffee enemas, and they say absolutely not do coffee enemas, then maybe a good question is, do you have some data that supports that? I mean, that's a fair question to ask. Why do you say that, doctor? Do you have any data that supports that? um, I think that's a fair question. I want you to question what we tell you to do, and not just to blindly follow what we tell you to do either. You should do your own research. And we try to give you that research. We have 400 and some videos on our YouTube channel. I have 400 pages blog posts, 300 pages of on our website, all to educate you so that you are making an educated decision. Now, I would argue that your oncologist clinic probably doesn't supply you with that same amount of information to justify what they're doing, and they want you to trust them solely by faith. That's where I would start to question maybe them about the validity of what they're asking you to do. So I know it's a difficult decision for everybody, and you want to be upfront and you want to trust your oncologist, but you also got to weigh out, the education that that person has. Don't ask me necessarily, how chemotherapy works. I can pull up some data and I can Google it and I can search it out, but I'm not going to tell you not to do chemotherapy just because I have this dogmatic approach. And that sometimes should be a red flag when a doctor answers your question with just a dogmatic answer that they have no basis in research to back up their answer. So also, is it okay for me to take all my supplements, specifically the Menelex Synergy, if I'm not doing the coffee enemas? If you choose not to do the coffee enemas, yes, you can still take the supplements that we have given you. And if you're doing chemotherapy, follow the chemotherapy protocol. Again, I would agree with oncologists that you shouldn't do antioxidants for at least 48 hours after you do chemotherapy. That does not apply to immunotherapy. Immunotherapy is not an oxidizing agent. And it says, I started the foot baths and plan on incorporating castor oil packs. Yes, that will all help with detoxification, help with liver detoxification. So those are all good. So again, the general answer to all these questions, you have to weigh out the data that the oncologist gives you, that we give you. Please do your own research. Please look up whether there's really valid reasons why somebody is saying something to you. Look that up for yourself. And then the next question that we had come in, totally different subject, is how fearful should I be of catching the virus? And this question has come up long before this whole COVID thing. People were saying, how fearful should I be of catching the flu? Or how fearful should I be of being around my grandkids if one of them has a runny nose? The answer to that is the flu and viruses and colds and sicknesses can be a concern if a person's immune system is really depressed. How do you know if your immune system is depressed? Well, your white blood cell count is low. So if a person is doing chemotherapy and and you know that you have a depressed white blood cell count, then yes, then being around, then you're in an immunocompromised state. And then being around somebody that is sick, there is concerns for that. But also the flip side of that is that there can be benefit to being exposed to a virus or bacteria or pathogen, because that is what will stimulate an immune response. So where is that tipping point where your white blood cell count is too low, that if you're exposed to pathogens, it could kill you? And the tipping point, the other side of, if you're exposed to pathogens, it will be the impetus that stimulates an immune response. Nobody knows what that is. You can't say at 3.51 blood cell count, do not be around. It's different for everybody. It depends on their overall health. So, but that was the whole premise of Coley's toxins, that if you inject a mixture of different pathogens in a person's body, you are going to fire this huge Th1 immune response, which T cells and macrophages are going to be dispensed, and you're going to have this fever state. Just like if you're exposed to the coronavirus or the flu, you're going to have this huge fever state, and it is going to help your body kill that which is circulating, a pathogen that's circulating, but it's also going to help your body kill recognize cancer. So with the Coley's toxins treatment, that doesn't exist anymore, and it was outlawed in the 1950s, and he was, called a quack even after he healed thousands of people from cancer with his treatment. Well, lo and behold, I saw on the news that Mayo Clinic is doing the exact same thing now in experimental tests, but of course it will end up getting shoved to the background because there's just not going to be any money in it, at least not like chemotherapy. So it won't be used, but it actually works. I've had patients that have gotten the flu, and that flu put them into remission. How? Because they got this huge fever state, this huge immune response because of the flu. It knocked the cancer down and put them into remission. I'm not saying that's going to be for everybody, and I don't think you should go, licking doorknobs so that you get the coronavirus. But don't be afraid of pathogens. That's how your immune system is built. What's the difference between someone? How do you say somebody's got a really strong immune system and somebody has a weak immune system? Well, you look at their white blood cell count, and normal, healthy people will have a normal white blood cell count. So then, what's the difference between those two people? If you're going to equate the strength of their immune system, you look at their antibody count. How many diseases do they have circulating antibodies against? That is the definition of a healthy immune system. The more pathogens that you are exposed to throughout your life, because you go out and garden and play in the dirt and you have no fear of being exposed to other people when they're sick, so that you actually, hopefully are exposed to that pathogen, so that you will fire a Th1 response and a Th2 response, which is a B cell response, and make antibodies against that pathogen. Then any like or similar pathogens that you're exposed to, you'll have an antibody response and you'll kill it and you'll never get sick. So that's how you build your immune system. So to be fearful of a virus or a bacteria, unless you have this horribly compromised immune system, is absolutely goes against immunology 101. So you want my opinion about wearing masks? It's absolutely ridiculous. It does nothing but bad things for you, and it certainly doesn't protect anybody else. So don't think you're doing the loving, kind thing by wearing a mask unless you have an N95 mask, because those viruses are not being hindered by a cloth mask, and you are still exposing other people to your pathogens, and you are being exposed to their pathogens, which actually is a good thing, but the mask is doing nothing. And if anything, you could end up hindering yourself because you're decreasing your oxygen flow to your body, and that's exactly what a cancer patient does not want to do, is decrease oxygenation. So please don't fall into this fearful state that you have to be, number one, fearful of this virus, and number two, that you should be wearing a mask, because that, as my cancer patients, I'm just telling you, you need oxygenation to this tumor. So any blockage of oxygenation, aka wearing a mask, is counterproductive to you healing from your cancer. So please do your research. Do not listen to what the CDC or the World Health Organization or other people that have other motives or are not doing their research on these subjects, for goodness sakes. Sorry, I get very passionate about this, but to see the absolute ridiculousness of what's going on in our society is just frying my cookies, I tell you. It's very sad, and I see people sucked into it, and I just want to shake my head and go, would you please do some research on your own and not just listen to what the governor's telling you. So that being said, no, you should not be fearful of the virus. And to answer these questions up here again, my opinion is you should continue doing coffee enemas, but you have to make your own decision based upon what the research that you're doing. Same thing with wearing a mask. You do what you want to do. It's a free country, at least kind of. Okay, I'm going to open it up and unmute everybody. And if you have questions, make sure if you've muted yourself, you'll have to unmute yourself. So,
hi, Dr. Connors. This is Dennis.
hello, Dennis. How are you?
Doing well. You mentioned about white blood count as a marker of our immune system. My blood count's been low and is right now at 2.32. It's kind of even dropping a little bit. So, what are the best ways to strengthen and build up the white blood count?
So some of the best ways to build up your white blood count is to use some nutrients that will help stimulate an immune response, which most of our patients, including you, I don't have your chart in front of me, so I don't know what you're taking.
Sounds good. I think
but
tomorrow and for Friday, if you
so most of our patients, all of our patients, are taking immune stimulants. That's what you're taking to help kill your cancer. So continue to take those, maybe boost those up for a period of time. And then just overall cell health is so important. So oxygenation, getting out and walking a little bit, getting outside, getting some fresh air, anything you can think of that would be a healthful thing to do is something that is going to help build your white blood cell count.
Okay, thank you. I'll be in next week and for testing anyhow, so we'll see you then. Thank you.
Looking forward to seeing you. Any other questions?
What would be good for brain fog and a headache?
So again, with just like anything, you want to try to figure out what the cause is, right? So if the brain fog is from a medication like immunotherapy,
Right.
then you want to work on trying to detoxify, really. So some of the things that generally are good for brain fog is herbs like bacopa, ginkgo. These are all in the classification of adaptogenic herbs, but also things like curcumin, turmeric, ginger, boswellia. Those are in the classification of anti-inflammatory herbs. So when you think of brain fog, so typically when you think of brain fog following chemotherapy or immunotherapy, it's more of a toxicity. So bacopa is nice because it increases the vascularization to the brain.
Could you respell that?
It's Bacopa. I
Thank
think
you.
that's what it's bacopa. It's in many of our like adaptogenic products, like the adaptogens. I think has bacopa, um, and then uh, the anti-inflammatory things would be good.
Thank you.
They'll help flush that out.
Great. We're doing castor oil packs and ion treatments every day, the clear line. Is there anything else we could be doing?
You're on the right track there. You're just helping your body detox. So yes, you could do um, baths with Epsom salts. So magnesium can be really good for the brain too. So that's what Epsom salts are.
Right.
So you can put some lavender or essential oil in that. That can be really nice. Even if I can't get in the bathtub, do a foot bath with that too, just a foot soak.
Okay.
That can be helpful too. Um, if you have a sauna, saunas are also great for that too.
Hmm.
Yeah, I think you're on the right track there. Also, if the brain fog is due to, let's say, past chemotherapy, like I had the chemotherapy a year or so ago, then doing some brain-based type therapy. So your neurons work on a use it or lose it principle. So you will actually trim neurons due to lack of use. So the way that you build, and neurons can get damaged by chemicals and medication and chemotherapy and immunotherapy. So building that brain back up is what's called a brain-based therapy. So doing things like crossword puzzles um, uh, and jigsaw puzzles are very good for your brain. Any novel activity, meaning anything new to you. So if I'm sitting there zoning out watching a television, that's not activating my brain really at all. So you want to do something new, learn a new skill, um, doing a crafty thing because you're doing something new all the time, doing that craft together. Um, those novel things are really, really good for your brain. And that can help clear the brain. So think of those things too.
Okay.
Now that I'm on that subject, I want to, something I typically forget when people have pain. So pain, you think, what am I going to do with pain? Okay, marijuana, you can use CBD oil with pain. I don't want to take medications. I forget this a lot, that doing brain therapy is extremely helpful to help decrease pain. Over the years, I've had people I have this one patient. She's not on this call and on our Facebook page because she started with me about 10 years ago. And actually, her testimony, though she wrote it about 3 years ago, is on our page on our website. She had rectal cancer, and she's still going strong. She had rectal cancer so bad, and she did not want to do the surgery. Finally, I talked her into getting that surgery done, but still has the cancer. But she had pain so bad she could not sit. She had to lay down all the time if she wanted to rest. And she's had the absolute best attitude of anybody I've ever met. And I just cherish her. But one of the ways she dealt with the pain is doing jigsaw puzzles. So jigsaw puzzle, how is that going to work? Because it actually fires a part of your right brain and your left frontal lobe, and it can inhibit, firing your frontal lobe can inhibit the parietal lobe. The parietal lobe is where you have all sensation come into. So if I smash my big toe on the right, on the foot of my bed, where do I feel the pain? Well, I feel it in my big toe. Well, actually not. I'm actually feeling the pain that it affected a receptor on my big toe on my right side, fired up my leg, crossed at the cord, goes up the spinal cord to the left parietal lobe, and that's where I'm sensing the pain in my brain is then communicating to my frontal lobe. You just smashed your toe and it hurts like the dickens, and I have this huge pain in my toe. Well, if the more I fire my frontal lobe, I inhibit the parietal lobe. So if the more things, that's why you can say, well, if I'm really in deep thought, I didn't feel that my leg was falling asleep or that, whatever, because firing the frontal lobe, you inhibited the sensory component. So another nice little thing to do to add to your pain protocol is to stimulate the frontal lobe by firing the frontal lobe. Your prefrontal cortex behind your forehead is what I'm talking about. And that's where you're thinking, you're planning, you're trying to put something together. That's why puzzles can be really effective, because you're having to find that piece and you're looking for this piece, how it fits together. It's new every time you do the puzzle, pretty much, the jigsaw puzzle. Even if you did the same jigsaw puzzle every day, it's still new because you can't memorize all those 1,000 pieces. So doing a jigsaw puzzle can inhibit pain. Crazy as it sounds, but it can work. It's another piece to add to that. Does a lot of other things that we just talked about too.
Can games on your devices do the same thing?
Kind of, yes. As long as you have to plan and think about what you're doing, yes, they can. So that can be a positive thing too. So.
One other question regarding nausea. The nausea seems to come when I think about eating food.
Okay.
I just can't eat sometimes.
Okay. So isn't it interesting how your brain works, right? You just think about eating food and you get nauseous. How does that work that way? Well, again, you have to kind of, for a better way to say it, you have to kind of be smarter than your brain. So you got to go, okay, well, I'm just going to eat food without thinking about it. And even though I feel nauseous when I think about it, part of why you get nauseous when you think about it is because even thinking about food, your stomach starts to release hydrochloric acid. And if your stomach is already upset, that's already going to start upsetting your stomach. You also have a nausea center in the midbrain. And just thinking about food, you can fire back to that center. And again, the way the brain works is that there's a concept that says the more you fire a pathway, the more that pathway is going to be strengthened. So don't start equating things even in your mind with what you just said. And that's not like mind over matter thinking, it's just neurology. So even if it may be true that every time you think about food, you get nauseous and you don't want to eat, stop saying that. Just like stop saying, oh, my doctor said I only have 3 months to live. Why do you stop saying that? Well, because you don't want to reinforce that neurological pathway. And because the more you fire a pathway, the more that pathway is laid down, and that can become a truth to you. So from a neurological standpoint, your body can then fulfill that. So I do, you're trying to be a realist, but you're trying to be smarter than your brain and not let your brain lay down that and strengthen that neurological pathway. So just try to, okay, if you got a friend helping you make food, just tell her, I don't want to think about food anymore. When it's time to eat, just give me the food and I'm just going to snarf down what I can as fast as I can. Then I'm going to put it aside and I'm going to just keep working on it that way. So you're trying to fool your own brain. So you're not firing that pathway and doing two things, firing back onto the nausea center of the midbrain and firing down to the stomach, causing hydrochloric acid production prior to you actually having any food in there. So bottom line is, even if you feel nauseous and you don't want to eat, try to get something in your stomach. Even if it's a little bit, get it in your stomach. So what hydrochloric acid was produced has something to work on, and it's not just gnawing at your stomach wall.
Thank you very much.
I have a quick question.
Dr. Connors.
Hold on. Who is the person that
I want to know, is the rifle machine going to affect a small dog?
Yes, it will. So I tell you,
She sleeps with us, and she was in bed till 1 o'clock today.
What kind of cancer do you have that we're?
It's lung cancer.
So the lung cancer frequencies, if the dog has cancer, so understand. So we put in the program the frequencies that the person has a diagnosis of lung cancer. We're going to put in all the known lung cancer frequencies. Plus, we're going to put in other cancer frequencies for other cancers that we test for, regardless of what the person's diagnosis is. Plus, we're going to put in the frequencies that were on that person's scan if you came in for the 2 days.
Yep.
If you didn't, you wouldn't have those in there. Plus, we're going to put in we put in frequencies for liver, kidney, detox, etc., like that. So if the animal doesn't have cancer, then they're going to be completely no effect of all the cancer frequencies.
Okay.
But they will have effect on the detox frequencies and stuff, and they might be detoxing. So
okay.
That's a possibility. We have at least 15 testimonials of patients that have said, I didn't tell you, but my cat had kidney cancer, and every time I turn on this blasted rifle, it jumps on the bulb. And now after 6 weeks, I had to bring it back to the vet, and the vet said, what have you been doing? I can't find any cancer. So that's pretty amazing. So
okay.
Dogs and cats kind of have this uncanny ability to sense what's good for them or bad for them. So if your animal is attracted to the rife, let them be exposed to it if you love your animal, so that it will probably be very healing for them.
Great.
If she's like overly sleeping or something, then you think, well, maybe she's detoxing or something like that, and maybe move it a little away from them. We have infants in bed with, human infants in bed with their parents with cancer. So, and we have little babies with cancer that are using this thing all the time. So we've never seen any ill effects of it.
Great. Thank you.
Yep.
So if you sleep a lot,
Dr. Connors,
Yes.
Go ahead.
are you able to hear me?
I can. Yep. Go ahead.
The question I have leukemia. Can I place the bulb near my legs, and will that be effective rather than on my chest or near my chest?
Yep. So the bulb actually goes out about 8 feet. So we have some people that, oh, it just bugs me up on my chest. Can I put it down on my legs? Absolutely. So for sure, it's going to affect your whole body. Yes. Yeah. So you can put it, down at your legs at night. That's just fine.
Second question is, if I have it, I have a bit of a heart condition. If I put this bulb running the leukemia program at night, if I put it too near my heart, I will get some pain that I really don't need. So I need to back it away. The question being then, would a ground sheet benefit me?
Would a grounding sheet benefit you?
Ground sheet?
Yeah, a grounding sheet. Yes and no. So I'm kind of split on the grounding sheets because, so if you have a grounding sheet, it's going to draw anything to it and then back to your ground and out into the ground through your copper wiring of your house. So you can lose frequencies with a grounding sheet. So typically, I say to my cancer patients, if you want to use a grounding sheet, just keep it on the lower half or lower 1/3 of your bed. But if you're having your bulb way down there, well, then you could lose a lot of the frequency. So I don't, you know, if you're going to put your bulb, the one thing you could do is you could put the grounding sheet on the upper third of your bed. And if you're going to have the bulb down by your legs, that makes more sense. So the frequencies are going to go through you to that grounding sheet. So for you, that's what I would suggest. For other people that are kind of hugging the bulb, then I tell people to put the grounding sheet down at their legs so the frequencies are going through them that way. So yeah, you certainly could. I don't see anything wrong with using a grounding sheet. The only thing I have dispute against is if you have the grounding sheet on the whole part of the bed and the bulb falls next to you and is basically laying on the grounding sheet, I think you're losing a lot of the efficacy of the frequencies. So that's where I say just be careful where you put it.
Thank you for clarifying that. I appreciate that.
You bet.
Dr. Connors, I have a question. Actually, it's a two-part question.
Okay.
I have lettuce, kale, spinach in my garden, and we're battling this CAFO that's 2,000 feet from us.
Uh-huh.
We can see the particulates coming out of the fans, and they're headed right toward us. We can't ever see the plume cloud get to us, but we're leery of eating these leafy vegetables. So question number one, I know that there are sprays like you can clean with. Do you recommend them? And then question number two is, we have presented this problem to our state senator and representative, and they want me to find them a scholarly article that verifies that these particulates could be getting on our vegetables. So I've gone to Google Scholar, I mean, I've read about it in books, but do you know of any other research option out there that might have articles about particulates coming from toxins and
I
how they,
don't, but one of the things that you could do is contact your local university chemistry lab.
okay,
Just saying, throwing this out there, this might be a possibility, and talk to the organic chemist and say, or the biology, lab, and say, hey, are you interested in testing? And kind of give them your scenario in a way that doesn't put them in a position like, oh, I don't want to get into this battle, but say, hey, would you interested in doing testing on whether, particulates from a pig farm, how many get on lettuce leaves, and see if they'll test it, because that's really an organic chemist's question on in a testing facility. Um, there are labs, independent labs out there, food labs and such, that do this kind of testing. Um, and I don't think it's exorbitantly expensive to have it done, but I think if you could talk to some organic chemist or biochemist, they might say, yeah, that'd be kind of cool. I could have my students do that or something. Um, they might do it for free. But I think an independent lab might do it for testing, because they have to do it for foods, to test if there's, they do that kind of testing to test the amount of calories per serving. And, they get that data because of an independent lab did that testing. So I think you could have them contract an independent lab to do testing on your food, especially when you say we're an organic farm and we want our food independently tested for these kind of things. Then you'd have really hard data on what is going on with yours, at least,
okay,
and then you could test comparative testing by using one of those washes. I know, like Young Living has it, but you could, a lot of different companies have those vegetable washes, and say, here's what's the parts per million of these particulates prior to washing and after washing. That'd be
okay,
really
yeah,
interesting data.
yeah, that's good advice. Thank you so much.
But short of other things, if you go on Google Scholar and search Google Scholar for these things, thinking of everything you could possibly think of to pull up articles.
Okay, thanks.
You're welcome. Unfortunately, on that topic, we always like to look for research, but you have to understand that any real good, valid research that is going to contradict the way that pharmacology wants you to think is either going to be buried or isn't going to end up getting published. And I don't want to sound like a conspiracy theorist, but this is just the awful truth. If you have any research that actually contradicts pharmacological data that they want you to believe, the chance of you getting it published in a peer-reviewed journal is like zero. So it's going to be published in an off journal, if at best. So there are really good researchers out there, um, but not necessarily getting a lot of their data published. And that's extremely unfortunate, because all of our research, all of our journals are now controlled by pharmacology, and there's just so much bias out there. This is where you just need to start doing your own studies and talk to really great researchers who will actually tell you the truth about what's going on in the world. And it's so hard. I understand people's dilemma of who do I believe? I just don't understand anymore. And this is where just continuing to study and learn some things about your immune system that then you can discern whether what the CDC is telling you is true or the World Health Organization is telling you is true. mistakes. They just came out with a thing. I don't know if you saw it, that the World Health Organization is saying just because you have antibodies against COVID does not mean that you're immune to it. Well, there is some truth to that, because if you have antibodies against one strain of the COVID-19, you may not be immune to the other strains. But it tells you right there with that comment that they're saying, how is the vaccine going to give you antibodies? First of all, just because you're vaccinated against measles doesn't mean you end up developing antibodies to measles. You have to fire a Th1 and a Th2 B cell response in order for your body to make antibodies against that thing which you're vaccinated against, which maybe, luckily, will happen maybe 30 to 50% of the time. So 30 to 50% of the time that you get vaccinated, do you even have antibodies, meaning you even are now immune to that thing that you got vaccinated against? Not to even talk about all the horrible things that are in a vaccine to stimulate an immune response. So it's this whole thing is such an unbelievable scam to take away our liberties and to get the entire world vaccinated. Not once, but they'll probably come out with 2 or 3 vaccines every year, just like the flu vaccine. Hasn't it done a wonderful job of wiping out the flu so nobody gets the flu anymore? Well, of course it hasn't. Still, everybody gets the flu. And the vaccines haven't prevented anything except made pharmacology companies richer and richer and richer. But I better get off my soapbox, because I've probably just alienated half my population here. So any other questions? Nothing? Well, thank you guys very much. We had a good long session today. And again, if you have questions that you don't want to ask, then just send those in to us, email, Zoom call questions, and we'll get this up on Facebook. Oh, a reminder to whoever's still listening, we are switching off of our Facebook platform, though we will still have it going live for at least 3-4 months. But we want to move everybody onto our new platform. We will post it on Facebook actually yet this week, so everybody can get logged on to our new forum community, which won't be blocked by Facebook. So love you all. I wish you the best, and I'm praying for all of you, and we will talk again very soon.
Thank you.
Thank you.
Bye-bye.
Thanks.